Hey everyone, welcome back to Speak Healthy. Today, we are going to talk about chronic venous disease and 5 ways to reduce the risk of getting it. Chronic venous disease, or CVD, is a common condition that affects millions of people worldwide. It is caused by the malfunctioning of the veins in the legs, which can lead to symptoms such as pain, swelling, and skin changes. While CVD can be managed with proper treatment, prevention is always the best approach. In this video, we will discuss 7 effective ways to reduce the risk of developing chronic venous disease and maintain healthy leg veins. Number 1. Maintain a healthy weight. Maintaining a healthy weight is an essential component of reducing your risk of developing chronic venous disease. When you carry excess weight, it puts additional pressure on the veins in your legs, which can cause the valves inside the veins to malfunction. This can lead to the accumulation of blood in the legs, increasing your risk of developing varicose veins, spider veins, or other forms of chronic disease. Losing weight and maintaining a healthy BMI can help alleviate this pressure on your veins, reducing your risk of developing CVD. Even a small amount of weight loss can make a significant difference. For example, studies have shown that losing just 5 to 10% of your body weight can improve venous function and reduce the severity of varicose veins. One of the best ways to achieve and maintain a healthy weight is to adopt a balanced, nutritious diet and engage in regular physical activity. Eating a diet rich in fruits, vegetables, and whole grains, and lean protein can provide your body with the nutrients it needs to function optimally, while limiting your intake of processed and high-fat foods can help you manage your weight. In addition to healthy eating habits, regular exercise is essential for maintaining a healthy weight and reducing your risk of developing chronic venous disease. Exercise promotes blood flow and strengthens the muscles in your legs, which helps your veins function properly. Aim for at least 30 minutes of moderate intensity exercise most days of the week, such as brisk walking, cycling, or swimming. Number 2. Stay active. Regular exercise is a critical component of maintaining healthy veins and reducing the risk of developing chronic venous disease. Physical activity promotes blood flow throughout the body, which is essential for healthy veins. When you exercise, your muscles contract and squeeze the veins in your legs, pushing blood back up towards your heart. This helps prevent blood from pooling in the veins, which can cause varicose veins, spider veins, and other forms of CVD. In addition to promoting healthy blood flow, regular exercise also strengthens the muscles in your legs. Strong muscles help support your veins and reduce the pressure on them, making it easier for blood to flow back towards your heart. This is particularly important if you spend a lot of time sitting or standing, as this can put additional pressure on your veins and increase your risk of developing CVD. The American Heart Association recommends that adults get at least 150 minutes of moderate intensity exercise each week. This can include activities like brisk walking, cycling, swimming, or jogging. Alternatively, you can engage in more vigorous exercise such as running or high-intensity interval training for shorter periods of time. If you have a sedentary job or lifestyle, it can be challenging to get enough physical activity each day. However, there are several ways to incorporate more movement into your day. For example, you could take regular breaks to stand up and stretch, take the stairs instead of the elevator, or walk or bike to work instead of driving. Number 3. Wear compression stockings. Compression stockings are specialized hosiery that are designed to apply pressure to the legs and feet, helping to support the veins and promote healthy blood flow. They are made of a stretchy, elastic material that gently compresses the legs, reducing the diameter of the veins and increasing the velocity of blood flow. Wearing compression stockings is an effective way to reduce the risk of developing chronic venous disease, particularly if you are at high risk due to factors like age, obesity, pregnancy, or a family history of CVD. Compression stockings can help prevent blood from pooling in the legs, which can lead to varicose veins, spider veins, and other forms of CVD. If you are at high risk of developing CVD, your doctor may recommend wearing compression stockings regularly. They may also be recommended if you have already developed CVD or if you are recovering from a venous procedure or surgery. Compression stockings are available in a range of sizes and compression levels, so it is essential to work with your doctor or a certified fitter to find the right type and fit for your needs. When wearing compression stockings, it is essential to follow the manufacturer's instructions for putting them on and taking them off. It is also important to wear them consistently as directed by your doctor to ensure that you get the full benefits of their compression. Number 4. Elevate your legs. Elevating your legs is an effective way to promote healthy blood flow and reduce the pressure on your veins, making it an excellent way to reduce your risk of developing chronic venous disease. By elevating your legs above your heart, you can help improve circulation and reduce the amount of blood that pools in your legs, which can lead to varicose veins, spider veins, and other forms of CVD. If you spend a lot of time sitting or standing, it can be particularly important to take breaks to elevate your legs throughout the day. Try to find opportunities to raise your feet and legs above your heart for at least 15 to 20 minutes several times a day. This can be done by lying on your back with your legs propped up on pillows, sitting in a reclining chair with your feet up, or using an ottoman or footrest to elevate your feet while sitting. While elevating your legs, it is essential to ensure that your legs are above your heart. This allows gravity to work in your favor, helping to promote healthy blood flow and reduce pressure in your veins. It is also important to make sure that you are comfortable and supported, as this will help you relax and promote the benefits of elevation. In addition to elevating your legs throughout the day, there are other lifestyle changes you can make to reduce the pressure on your veins and promote healthy blood flow. These include maintaining a healthy weight, staying active, wearing compression stockings, and avoiding long periods of sitting or standing without taking breaks to move around. Number 5. Avoid smoking. Smoking is a well-known risk factor for many health conditions, including heart disease, lung cancer, and chronic obstructive pulmonary disease, or COPD. However, smoking also damages the blood vessels in your body and can increase your risk of developing chronic venous disease. Smoking damages the inner lining of your blood vessels, making them less flexible and more prone to inflammation and the development of plaque. This can reduce blood flow and increase the risk of blood clots, which can lead to CVD. Smoking also increases blood pressure, which can put additional strain on your veins and increase the risk of developing varicose veins or spider veins. If you smoke, quitting is one of the best things you can do for your overall health and for the health of your veins. Quitting smoking can help reverse some of the damage that smoking has done to your blood vessels and reduce your risk of developing CVD. It can also improve your lung function, reduce your risk of cancer, and increase your lifespan. Quitting smoking can be challenging, but there are many resources available to you to succeed. Talk to your doctor about smoking cessation resources and support, such as nicotine replacement therapy, medications, or counseling. You can also seek support from friends, family, or support groups, or use apps or other tools to help you quit. Number 6. Practice good posture. Good posture is important for overall health, including the health of your veins. Poor posture can cause blood to pool in your legs, which can increase the risk of developing varicose veins or spider veins. It can also lead to back pain and other musculoskeletal problems. To reduce your risk of developing CVD, it is important to practice good posture. When sitting, sit straight up with your back against a chair and your feet flat on the ground. Avoid crossing your legs for long periods of time, as this can restrict blood flow and increase pressure on your veins. Instead, try to sit with your legs uncrossed or with your ankles crossed. When standing, stand with your weight evenly distributed on both feet, with your shoulders back and your head up. Avoid locking your knees or standing in one position for too long. If you need to stand for a long time, try to shift your weight from one foot to the other or take breaks to sit down and rest. Practicing good posture can also help improve circulation and prevent other health problems such as back pain and muscle strain. By making small changes to your posture habits, you can reduce your risk of developing CVD and improve your overall health and well-being. Number 7. Avoid wearing tight clothing. Avoiding tight clothing is another important step in reducing your risk of developing chronic venous disease. Wearing tight clothing, especially around the waist, hips, or thighs, can restrict blood flow and increase pressure on your veins, which can contribute to the development of varicose veins or spider veins. To reduce your risk of developing CVD, it is best to opt for loose-fitting clothing that allows for healthy circulation. Choose clothes that fit comfortably and do not constrict your waist or legs. Avoid wearing tight belts, pants, or skirts that are too snug. If you need to wear compression garments or shapewear, it is important to choose ones that are properly fitted and designed to promote healthy blood flow. Compression garments apply gentle pressure to your legs, which can help to improve circulation and reduce swelling. However, it is important to choose the right level of compression and to ensure that the garments fit properly. Wearing a compression garment that is too tight can actually increase the risk of developing CVD. In addition to choosing loose-fitting clothing, it is also important to maintain a healthy weight, exercise regularly, and elevate your legs to reduce your risk of developing chronic venous disease. By making these lifestyle changes and taking steps to improve your circulation, you can help prevent the development of varicose veins, spider veins, and other types of chronic venous disease.